All right, good morning, everyone. This is Phil Pugh, Director of Emergency Management here at Memorial Hospital Belleville and Healthcare Coalition Chair. We're going to get started with our monthly meeting. Hopefully today will be fairly short. We'll do a quick roll call and it'll be kind of a rehash of last month's meetings because those are really where our priorities are. So go ahead and get started. As a friendly reminder, if you haven't checked your Siren account, please do that. Make sure your passwords are up to date and make sure you have access. Those do go out of style every 90 days, I believe, or something close to that. So please make sure you update your password there. For my hospitals, quick question to you. Have you conducted a resource request through your local health department recently? If not, contact them and maybe set up an exercise just so you guys make sure you still have the process mapped out. I know a lot of folks have done resource requests here through the RHCC and through their EMAs over the course of COVID, but things change over time. So we want to keep you guys or we encourage you guys to stay in the loop on how to make sure you're doing the resource requests properly. Let's go ahead and talk roll call. So we'll start with our hospitals. We'll start with Anderson.
Eric's here.
Thank you, Eric. Alton Memorial. I know they're changing positions at Alton, so okay. Boyd.
Nancy Wallmeyer here.
Hey, morning, Nancy. Carlinville Area Hospital. Staunton. No Sue. We had Sue last month. No Sue this month. Okay. Fayette County. Gateway. All right. HSHS Holy Family. How about St. E? Well, at St. E's, I know they're doing a class now. We have a decon class going on over there currently. So I may not have anyone from St. E's. Anyone from Breeze or Highland? Jersey Community. From Belleville, you got Memorial Hospital Belleville and Shiloh. You just got me today. Lee and Eric and Scott are over teaching decon class at St. E's this morning. I don't know if Karen is on. Can't see. Let's see. OSF St. Anthony's. I thought I saw Gary.
Gary's present.
Gotcha, Gary. Chester. Sorry, I didn't want to skip you, Georgia.
I'm here.
Gotcha. Redbud Regional.
Yes, Tara's here.
Gotcha, Tara. Sparta.
Here, Phil. Dan's here.
Gotcha, Dan. Thank you. And anyone from Touche by chance today? They are going through a transition at Touche currently, so I'll probably be without a direct HPP coordinator for a while. Health departments. We'll start with Bond County.
Terry, I'm here.
Gotcha, Terry. Calhoun. Clinton. East Side Health. Thought I saw Charmaine on here. I do see Charmaine. If you want to just hit me something in the chat, gotcha. Fayette, Greene County, Jersey.
Heidi Carter's here.
Gotcha, Heidi.
Hey, Green's here. Sorry, this is Molly.
Gotcha, Molly. Thank you. Macoupin County.
So,
Who was that last? I'm sorry.
it's Derek from Macoupin.
Gotcha, Derek. Thank you. And Charmaine, I saw your text in chat. Thank you. Madison County. And Monroe County.
Vicky here.
Gotcha, Vicky. Thank you. Randolph County. And St. Clair.
Hi, it's Kara. I'm here.
Gotcha, Kara. Thank you. Community partners, we'll start with Greg, our REMSC.
I'm here, Phil.
Gotcha, I see you. Emergency response coordinator, is Beth on?
I think Beth is off for a couple of weeks.
Okay, gotcha. Any BJC partners on today? Any other community partners from emergency management agencies across the county? All right, MedStar. I thought I saw Steve on MedStar.
Got John Delphi.
Okay, gotcha, John.
Chuck's here also.
See Chuck. Okay. Thank you. Abbott.
And I'm here too.
I'm sorry, I didn't hear that. Who was that? Is that Steve? Okay, gotcha.
Leslie from Abbott is on.
Was that Leslie? Gotcha. St. Louis University, Slu.
Good morning, Helen Stanquil.
Gotcha, Helen. Thank you so much. Any of our Scott Air Force Base partners and stars.
Yes, sir. Dale Chambers.
Gotcha, Dale. I see Amy just joined from Touche. Thank you, Amy. If you weren't called, you want to make sure you recognize this is your opportunity. Either put a note in the chat or you can sound off now. Looks like we got a good group of folks. We got about 30 folks, huh?
Hey,
This is Ashley from the-
Brian.
Uh-oh, had two folks. Ashley, which Ashley?
Yeah, this is Ashley Hiltman with Residential Hospice.
Gotcha. Residential Hospice. Ashley, thank you.
Hey, Philip, this is Brian. I'm representing Alt Memorial.
Gotcha, Brian. Thank you so much. Any other folks? So we make sure we get folks copied down properly. Not, if you don't want to shout out again, just toss it in the chat or shoot me an email. Gotcha, Samantha. Stars represented well. Gotcha. Thank you very much. All right, we'll go ahead and get in. We're basically gonna have our standard agenda, and we'll try to run through it as quick as possible. That's the current curve of hospitalizations. It's not up to date as of this morning. Those numbers are from what was reported, through yesterday. This is where we're at currently. I like the tone of that curve. Hopefully it continues to trend down. We did see the last couple of days, a little spike. Gotcha, Scott. I see you. We did get a little spike last couple of days, and our folks to the south in the Marion region who've been struggling a little bit did see a good reprieve from COVID with regard to the ICU bed availability over the last couple of days. Yesterday, I think they started out with 15 beds, and that's better than they were a week ago because it was one bed here, one bed there each day. So I didn't get a chance to look this morning yet. I'm just getting back in from a doctor's appointment. So hopefully they're doing much better today. So let's keep pushing that curve back down. We're pretty much at a low, almost a little over a 2-month low now. So that's great news. These are patient expirations in hospital settings. September, we did have a bump up, but looking at early numbers this month seems to be a little calmer. But that's where we finished off in September, averaging around 1.6. Patient deaths per day. So, all right. Here's our regional COVID outlook. 4.3% positivity rate, 28% ICU bed availability. All good numbers. Hopefully we've kind of flattened out, as you can see, with regard to that 4.3%. So we've just hovered right below 5 for a while. Hopefully we can break back down into the 3s. By next week. That would be great, and hopefully rapidly back down to the 2s and 1%. That would be outstanding. As you can see, as far as vaccine data, folks are continuing to get vaccinated here. So we made a 2.8% increase in vaccinations across our counties, which is great. And we got, I think, how many we got over 50%? We got 2 counties over 50%. So Madison County and Monroe County currently over the 50% mark, which is great. Still have some counties out there that are in the 30s, but 43.71% across all counties, still pretty good. Hopefully one day we'll get to the 60-70% rate and really kick this thing in the rear. All right, so barring any questions regard to COVID updates, anybody have any questions with regard to any of the information just recently presented? No? Okay, great. I'm gonna put Helen on the spot right now since I'm talking about COVID before we jump into our standard. Um, I know, Helen, you had an opportunity to go down deeper into Missouri. If you wouldn't mind kind of giving just a brief synopsis of what you had the opportunity to do while they were going through their surge.
Phil, I'm chief nurse for Mo1 DMAT with SEMA, and we were asked to open up an outpatient monoclonal antibody clinic. So the first one we opened up was in Springfield on July 23rd. And that was to decompress the Springfield hospitals. They were doing monoclonal antibodies outside of their EDs to keep people out of the hospital. It was for people with mild to moderate COVID disease. And then later on, it was for people that did not have COVID, but that were exposed to COVID, just to keep people out of the hospital. That's how bad it was down there. And we wound up being open for about 6 weeks. We wound up seeing 871 patients in an old price cutter warehouse. We were very successful. We only had 4 patients that wound up having to go to the hospital and 2 allergic reactions that were actually mild. We also opened up state clinics in West Plains and another part of the state. And we have 1 clinic that's left open. Other than that, they're pretty much, there's clinics open up privately throughout the state, and they've been very successful. So things are kind of winding down over here.
Well, that's great, and thank you for taking the time out, to jump on a team like that to go help. But as we all would love, nobody wants anyone to get sick, but if they are sick, we definitely want them to have a mild case and to definitely not overrun the hospital, so we can still treat those who either are very sick with COVID or have another procedure that they need to either have done or chronic illness that they need to be treated. So great work down there. We're super, super proud of those efforts, and hopefully, the benefits continue to pay off. And we continue to push that death curve down, because that's what's really heartbreaking. I know just this past week we exceeded 700,000 deaths across the entire U.S. And I think during the Spanish flu, I think we're at 665,000 in the U.S. deaths, directly contributed to or directly attributed to the Spanish flu over 100 years ago. So that's a milestone that no one really wants to have, but at least keeps it in the forefront of our minds of where we're at in this journey. And hopefully that number just continues to day by day go down. I think yesterday we were at around 1,500 per day that we were losing in the United States. So we're going to make.
I was a little bit afraid of doing that because I didn't know what to think about monoclonal antibodies. I'm a firm believer that they truly help because we saw a lot of successes with that type of treatment down there. And at one point, it was so bad in Springfield that we had one weekend where we had so many people that were sick that needed ICU beds. And the only way that we were able to accommodate them was that we had so many people that died that weekend to free up beds for those patients. Otherwise, I don't know how we would have done it.
Wow. Do you remember which product you guys were using specifically down there? Or
we used Reagan Cove.
Checking off my list.
Okay, and that's the Regeneron?
Yes.
Got it. Okay. Well, again, thank you very much, and thank you for sharing that. So
thank you.
Coalition Partners doing great work in and around our local area and extended area. So we'll just go ahead and start with general updates. Greg, we'll start with you from IDPH.
Hey, Bill. I don't have a whole bunch. As you know, the emergency rules were written for the governor's executive order talking about vaccination and testing requirements in employment. EMS rules have been posted as well. Hospital rules are posted by hospital regs, so I really can't speak as clearly to those, but just want everybody to be aware of that. I'm going to harp on the EM resource again. We do have some hospitals that are missing some updates in that, so please just know this remains very important, especially to our Region 5 folks. They still are struggling, even though they have improved on the number of ICU beds and med-surg beds that they have available in the region. So when they call us looking for beds, meaning IDPH, we are looking at Region 4 numbers and deferring to hospitals that we see open beds in first before we then move to place them in VA hospitals, including the Marion VA, the St. Louis VA, and the Danville VA. We would much rather have them in hospitals relatively close and not using the federal facilities if we can avoid it. So please make sure those numbers are accurate and let your hospitals know that those Region 5s may still be reaching out to them about transfers to their facilities, though it has quieted down quite a bit the last 3 days. And other than that, I think that's all I have, Phil. I do know that I think Belle Claire Fairgrounds has opened up for vaccinations. I know Beth isn't here, so I don't know if there's somebody from the health department that on this call wants to just kind of give an update. I think Tuesday, Wednesdays, Thursdays for boosters, but if there is someone on the call that knows that for sure, that'd be great to give an update to everybody.
Kara, is that something you could speak to?
Yeah, sure. So yesterday we opened up our first day down at the fairgrounds. We are open 10 to 8 Tuesdays, Wednesdays, and Thursdays. We're doing the Pfizer boosters and also the any of the other first, second, third dose as needed. Appointments are strongly encouraged, but if they do come through without an appointment, they can get in. Yesterday was our opening day. We had right at about 600 vaccinations given. So, there was definitely interest. Most of those folks came through without appointments, but we were able to get them in. So it moved on pretty well. We're still at 330 West Main with all 3 types of the vaccines, and that's from 10 to 6 every day.
And we're strictly doing boosters there. Is that correct? Not initial?
You can get initials at the fairgrounds as well.
Okay.
We just have Pfizer down at the fairgrounds. We've got Pfizer, Moderna, and Johnson & Johnson at our 330 West Main location.
Got it. So thank you. Thank you so much,
You're
Kara.
welcome.
Again, I'd like to pause for any of the other health departments if they wanted to make any announcements that they have for their local counties and that we may need some situational awareness of. All right, that's 5 Mississippi, so we'll press on. Thank you guys for that update. Stars, Dale.
Not a whole lot, Phil. Thankfully, we are mirroring your downward trends in hospitalizations and infections and things like that. So we're happy to see that. I will add a little bit to Helen's great work that she was briefing out on. We do have 2 state-supported, contracted MAB sites in our footprint over here. One is up at the Urban League, Peter Bunce campus in North St. Louis, organized by St. Louis Public Health along with Affinia Health. And then the other is down in Festus, is housed at Mercy Hospital. So both of those locations are state sponsored, and I believe right now I think the plan is to go through at least to the end of the month as for that contract. And we have a couple other healthcare facilities, hospitals that have that are doing MABs as well around the region. That is just a smaller scale, but you know, it's one. These two are part of 6 that the state of Missouri is supporting statewide to do all the work that Helen briefed out on. So that's about all we got.
Awesome, thank you. Any questions for Dale? All right, go ahead and move on. No REMERT updates for today. Mike is off actually on PTO, and again, Lee is out, so is Eric. They're all teaching, so no updates. But I guess the only plug I'll say is that you don't have to be a medic, nurse, doc to be on REMERT. So if you got some talent or you need some, or you know some folks who want to get some volunteer hours in, REMERT's a great place. Just let myself or Mike know if you have any folks interested, and we can put them to work. We will skip over our mental health team update today. I don't think Sue is on. I know Dane is not on, so we'll skip that. Pediatrics, Eric normally would brief on pediatrics, but I will just make a plug today for EDAP accreditation. If your hospital is not EDAP approved or has been and wants to get back into it, it's a great program for getting your emergency departments up to speed. A lot of times it's a lot of work, sometimes people think, but in the end, it does help out those pediatric patients and another feather in the cap of your organization. So if you have any questions with regard to EDAP, you could always reach out to Anna up at EMSC there, or just reach out to myself or Eric and we can get you clued in on it. We're going to go ahead. As far as grant status, we are still in the same spot. We are now in crunch time. So if you have not spent your money, it needs to be spent ASAP, because again, that 31st of October deadline will not be extended. So just asking you to make sure that you spend and then get your invoices in as quickly as possible. And the reason we want you to get those invoices in as quickly as possible is because we're going to have funds left over on that no cost extension, and we're going to need to reprioritize them and submit for whatever we're going to fulfill with projects that we have kind of outlining on the books. One of those instances are rounding out the ventilator purchases that we did on the last grant. So the sooner you get that money spent, the sooner you get in that invoice, we can get you guys paid back out and we can execute on those remaining funds. That leaves us only November, December, into 31 January of 2022 to spend those funds. So we need those invoices in as quickly as possible. Remember to send your invoices to gmo@bjc.org, and you can courtesy copy Sarah directly if you need to, but that will get it to her. But also send it to the invoices at swillhope.org email account as well. Most of you have been doing that and know that we haven't had any issues. The one issue that we have had for some of the invoices, please include not just the spreadsheet invoice of you requesting repayment, but also include your invoices that you had or purchase orders that you had for the actual procurement of that equipment or supply or whatever you used it for in your project. So I can see it and then I can relay it back and go, okay, yes, this is an approved purchase, so we can approve it as quickly as possible so you can get reimbursed as quickly as possible. Reminder for the Coalition Surge Estimator tool. Okay, Scott Klosterman is running this. Again, Scott's out teaching, but it's 30 November is the deadline. This is super easy to complete. We've only received, I think, one in, and that was from Gateway. I think Rick or Danielle, they sent that back in. It's super, super duper easy. Once you've completed it, just send it to the rhcc@swillhope.org email address group and org box, and to Scott Klosterman directly. Again, the link that you have here will take you to a place where you can download the one that you did in 2019 And for many of you, those numbers haven't changed. You might just need to do a quick QC on it and just send it back saying, here's the numbers, and we will get it done. We'll have this knocked out. This is a grant deliverable, and we want to make sure we get it done quickly so we can be on to the next thing. Hazard vulnerability assessment, another reminder, November 15th, we're asking that you guys have your HVAs done. We talked about the use of the Kaiser Permanente tool, and here's the download link for that. Most of you are very familiar with it. So please utilize that. And again, we're encouraging all of our provider types out there to conduct their HVA. Now, yes, it is primarily hospitals that accomplish these normally, but all organizations can benefit from doing their hazard vulnerability assessment and taking a look at where they need to identify, finding their shortfalls in training or limiting factors in training or any form of preparedness. So we're asking you guys to do this. We've asked the resource hospitals, and we've made, I think, a few pleas on the Wednesday calls for our EMS agency. So for my EMS crews that are on right now, again, asking you guys to do this as well. We're trying to get a more well-rounded look at our HVA with regard to provider types. So if you could, please knock this down. Once you've knocked it out, again, we're going to have more workshops. We've already had one on how to use the template and make sure folks understand it. But we want to make sure that we're able to compile all this information. And then, as we discussed before, we are going to be extracting the actual HVA from the full plan or our full emergency operations plan into a separate document, so it can kind of be, again, a little more tangible for folks. So that if they want to review it, they can just review that specifically with having just a summary inside the regional emergency operations plan. So, and again, we are moving forward as if SEMP will not exist. Greg, I don't know if you've heard anything on the IDPH side, if we're going to have SEMP past December, but if we're not going to have it, again, this is the reason why we're using the Kaiser Permanente tool.
I have not heard anything definitive.
Okay. All right. The MITAP, I'm going to skip over that, but we did hold at least one. I think there's a follow-up meeting scheduled. I would have to defer to Eric on when that's rescheduled, but we want to make sure that multi-year training and exercise plan is complete. So I'm going to pause right there and open the floor for questions or concerns. Terry, I know you had at least one question or concern.
Phil, can you hear me?
Yep, hear you loud and clear.
Yeah, okay. Just the health departments and their grant, we have to do something on burn surge. And I just wonder if the coalition had made any plans to do anything on burn surge.
So yes, Scott has been actually working our burn surge annex, and as a part of the deliverables this year, we have to do basically a tabletop to validate that burn surge annex. So we're in the process of scheduling and planning that out. What we need from everyone, so this would be a great opportunity for the health departments. When you guys see the link go out for the plan review, okay, I need you to take a look at that burn surge plan that we have in there and provide comment on that burn surge plan, okay? Because that's what we're going to use. So we get the comments that we get back from it, and then that's what we'll use as the premise for the tabletop exercise, and then that way we'll knock out exactly what is required, at least from our perspective, and that hopefully that'll help the health departments fulfill whatever FEP requirements that you guys have.
Yeah, I think that should cover the health departments.
Okay, again, the floor is open. Questions, concerns?
Phil, do you just need the HVA sent to you?
I will no, send them to here, and so everyone, just the same place where we're sending the the Coalition Surge Estimator.
Okay.
So that's to the rhcc@swillhope.org. And feel free to courtesy copy me and Lee. That's perfectly fine. But the rhcc@swillhope.org, you can send those compiled versions there. And we will host a kind of a workshop to go over it too. And, basically, so if you haven't sent it in hopefully by the time we're hosting that workshop, and then we try to get those in. But we want to be able to compile it and again, try to point out via provider types who's, where the vulnerabilities kind of lie, depending. So thank you for that question, Eric. Any other questions, concerns? Nope. Okay. Upcoming events right here. As today, we are doing decon class over at St. E's here in O'Fallon. Also, we have one tomorrow at Fayette. So the guys did a class last week in Jersey. One here, St. E's today, tomorrow Fayette, and then Gateway next week. So busy, busy, busy. And then after that, we got a mock survey here at Memorial Hospital Belleville. So for HFAP. If Nancy is on, Nancy, are you still on?
Yes.
Would you mind providing any feedback on how the class went? I know you did send in an email, but just to the rest of the coalition on how the class went.
Well, as many people know, we're a very small rural health hospital, and we don't have large access to funds. So we had what I call a primitive decon setup, but Lee and the guys did an excellent job helping us to make what the equipment we do have, telling us how we could do it better, and making very good suggestions. So the class was great in the morning. It was very helpful too. And then we did the hands-on in the afternoon. And I felt good about our team and our equipment. And I know there are some things we need to do, but that's all in the up and coming days. So thank you very much for doing that for us.
Our pleasure. We're glad that you guys were able to take advantage of that, and whatever feedback that you can provide us on how we can make it better. We're definitely accepting of. I know we did a little survey, class survey that we did. We are currently, I will say this, one of the things that we are working towards is on the information side is we're updating all the slides now. That's one of my priorities of what I'm doing, and we're building some actual pamphlets and guides and slide deck as an actual flip through book that we're going to get all professionally done. So hopefully that will help out, and we'll have it just like we have the slides now, readily downloadable for anyone in the coalition. So we're trying to keep moving that ball forward. And one of the things we're going to be trying to look at as well is that we're going to try to figure out a way to lighten the load for what we take out for the guys when they go out and do a class, or when I go out with them do a class. It's a laborious process because there's a lot of equipment and supplies that we take to your organization, lots of PPE, mannequins, a whole bunch of stuff. So we're trying to figure out a lighter, leaner way to do that. But we feel as though, at least right now, that it is definitely worthwhile with having the amount of equipment that we take out. And
Hey, Phil.
Yes, go ahead.
This is Molly in Green, and I just thought it was a great training, especially, for health department to see, think about environmental perspective and what we would need to consider, when you're out. There's environmental hazards that do occur. So it was great to see, that in action. And I think Boyd did a great job. I think there was definitely a few things that were considered, to have on hand, and doing the active training, definitely probably better prepared everyone. So I think it was a great training, and I would encourage other health departments to participate if possible, just to see, and environmental staff, it was definitely helpful.
Well, thank you so much, Molly, for that feedback. And yeah, a lot of folks, when we kind of, once they go through the training, they're like, oh, wow, okay, a lot of this makes sense. And, we haven't had a training where folks are like, that was a waste of my time. So that's been a good thing. For the, I guess, two years we've been doing this. We had the kind of 1 year hiatus. So, but the training has, I think from my perspective, gone well. And I'm not exactly sure exactly how much it has saved in contract costs. But at my last count, if we include, I'll do some rudimentary public math. We have about 185 folks trained that we've done in our course itself. And going price is about $1,500 a person when you have somebody contracted in. So that's about $277,000 that one way or another that we've potentially saved from my perspective. Yes, we are using grant funds. Those are your tax dollars, but we built that course, for a fraction of that. We spent about $1,200 to partner with IFSI and just using some of our REMERT team specialties with industrial hygienists and Don Ridenour and crews. That has been just tremendous. And we just luckily just have some local expertise here who's done it for a while, in previous lives, or, some hazmat specialists that we do have. So it's been something that has, it's been the gift that keeps on giving, and we want to continue to make it better and a model for the state. So thank you for everyone who's doing that. And again, if you ever have feedback or if you want someone to become an instructor, choose them wisely. But we are more than willing to get them up to speed. But it does take a lot. I'll just tell you that, quite frankly. If you try to put a nurse in that position that has no maybe fire department background or anything like that, they may struggle. It's totally not what they're used to. And struggling is fine, but they'll have to dedicate a lot of time to becoming an instructor with regard to this specific material, because it's, again, just not in their day-to-day lane. So, all right. Was someone about to say something? I saw something light up. Guess not. All right. A few other things on the horizon. IAM, International Association of Emergency Managers, is still going on. But I know the folks that normally go, I'm someone who attends that normally each year. We can't travel business-wise, COVID reasons, and for BJC, so we're not attending that this year. Maybe some of you are. Again, HVA completion, we're looking at trying to have it done by November 15th. Remember, get that into rhcc@swillhope.org. Coalition's surge estimation tool by the 30th. But I'll be honest to you guys, it probably literally takes you guys 5 minutes to take a look at it and say, yep, it's good, send it back, unless you've made some major construction or you've changed your bed statuses with the state over the past year, or something else has happened that we don't know about. It probably takes you about 5, maybe 10 minutes to knock out. I will be sending out an email again with the plan review link, and that's going to, inside of that, it's going to also have the governing documents. So basically our coalition governance document, our bylaws. I'm using air quotes when I say bylaws since we're not a corporation, but the governing documents. We want to make sure we just have those reviewed. And again, that burn surge annex is a part of this review. We will separately, the Executive Council, I think I have a meeting set up. We will be reviewing the strategic outlook over the next 3 to 4 months after we've done the HVAs back. We got that back. We've got the MITEP all situated. We're going to go back and redo our strategic plan. The last one we did was, I think we had it from 2018 to 2023 or 2022. I think it was a 5-year plan. So we're going to take a look at that and adjust as needed, and then represent those materials and kind of our way ahead over the next 5 years here soon. So probably can expect to see that more so in February timeframe. You'll probably see that from us in around February timeframe, but it is out there for everyone's review. So The assistant individuals in crisis and groups, crisis intervention, that class is still going on. And the National Healthcare Coalition Preparedness Conference is still going on. Again, we will not be attending this year because of travel restrictions. So, all right. Any questions before we sign off? If there are no questions, all right. Thanks for everything you guys do, and we will see you guys on next month, if not sooner. Take care.